Good morning, my name is Tim Lancaster. I'm the Dean of Medical Education at the UKCAT School of Medical Education within King's College London. I'm also a GP in the NHS. And I'm going to talk, I think, for about 20 minutes to try and give you a feel for our course, its characteristics, what its strengths might be, what the areas might be that you would or would not find attractive in our school. I hope to then have a few minutes for questions before we have a talk on admissions, which will outline some of the material that you need to know about applying here. So, King's College London, huge university, immense powerhouse in research and teaching, and for those who like league tables, the world rankings for essentially medical schools place King's at 17th. The GKT School of Medical Education is nested within King's College London, and that name really derives from the history of our medical school. It became the Guy's, King's and St Thomas's School of Medicine within King's College London. You can imagine there's a huge wealth of history as well as experience in teaching medical students within that network, which of course extends well beyond the three big hospitals. Members of the faculty include Dr. Knight, who's the head of Stage 1, that's the first year of the course. Professor Siebes Thompson is the director of our extended medical degree program, which I'll talk about a little bit later, and Dr. Despo, who's the director of the graduate program. So 3 streams we have into medicine, which I'll talk about a bit later, and a number of other. So you're thinking about a career in medicine, and I will give my opinion that this is the most exciting time in history to be going into a career in medicine. If I look back over my career, I've gone from diseases such as HIV, which the epidemic began as I graduated from medical school. At that time, an almost certain death sentence for most people. Now, with modern treatments, virtually every patient with HIV can live a normal lifespan. It's become a chronic disease. Heart attacks. As a GP, I used regularly to have people of my own sort of age and younger dying from heart attacks in my practice. Now, with modern methods of prevention and treatment, that's almost unheard of, premature death from cardiovascular disease. And cancer, we go on getting better and better at treating cancer. Coming up, we've got further payoffs from the genomic revolution in medicine. New drugs, new therapies, incredible diagnostics with imaging, monoclonal antibodies, the list goes on. So it's a very exciting time. But it's also a challenging time because as our life expectancy increases, more and more of us, as we stand at the moment, face living longer lives, but not necessarily better quality lives. We still have some big things to deal with, particularly dementia and chronic neurological disease, which we really haven't dented at all. I believe and predict that during your working lives, we will get on top of those problems. But at the moment, how we care for a population that is getting older, many of whom will have chronic disease, and many of whom will have multiple chronic diseases at one time, is a real challenge for our healthcare system. We've also got the problem of malnutrition in our society, with increasing rates of obesity, with its knock-on effects to increasing the prevalence of diabetes and cancers. So, although we've made enormous strides in some areas, we've also, in a sense, created new areas of challenge. And I think that'll be the interest for people going into medicine is in the next 50 years is how we deal with those problems, those at presently intractable problems. In order to meet those challenges, we have to think about what the doctor does. And this has been particularly pertinent here for us at King's because we are in the middle, almost complete, of a complete overhaul of our curriculum. It's called Curriculum 2020 because that is when the curriculum will be fully implemented. But if you come here to King's, you'll be coming into the new curriculum. What did we want to do when we set about redesigning our curriculum? Well, we wanted to take account of that increasing clinical complexity, the need for doctors who can deal with patients who have multiple different problems, and in particular, acknowledging that in many cases those will be both psychological and physical problems. This is one area that perhaps isn't done as well as it should be in the modern NHS, is bringing together the mind and the body. So a very strong emphasis in our curriculum on training doctors who can manage the whole person. We need doctors who can look critically at advances in medicine and determine which ones are really going to improve things and which are a waste of resources. We're of course having to deal with patients who are much more informed than perhaps they were in the past because of the internet and other sources of information. And we also have to think about the integration with social care, which is so important. So Curriculum 2020 has distilled from all of that 4 key themes. The absolute key theme, of course, is that we produce competent doctors who are kind to their patients and can help them get better. So that's absolutely at the center, patient-centered doctors. But we've also got a strong strand of developing critical and scientific thinking so that our graduates can deal with the increasing complexity of knowledge in medicine. Very distinctively, we wish our doctors to be champions for mental health. And another interesting stream is providing specific training in quality improvement. So that involves both didactic learning and, in the penultimate year of the course, the opportunity to work in teams to try and solve a quality problem in a real NHS setting. So this would be going into a particular area of a hospital, working with clinicians to identify a problem, whether it's trying to reduce inappropriate prescribing of antibiotics or looking at workflows within a radiology department, trying to identify some way in which we can really improve care in an NHS setting. And that's been fantastically successful in its first couple of years of running. We've had students presenting at national and international conferences and being invited to speak to the boards of major hospitals. This is a big medical school. It does mean we have an incredible range of clinical services in both primary, secondary and tertiary care. I already mentioned the 3 founding teaching hospitals of this medical school, Guy's, King's and St Thomas's, some of the most clinically sophisticated and advanced teaching hospitals in the country. But our clinical community is much wider than that, and as you can see, it extends well beyond the M25 and particularly into Kent and Sussex, where we have some really great partners in primary and secondary care. So broadly speaking, if you come here, in the first 3 years, in addition to science-based teaching here on the Guy's campus, you'll have clinical attachments which will be within London, within this circle, both in primary and secondary care. In the final 2 years of the course, you'll be spread more widely. Some of the rotations will be in London, but some will be outside of London, and that is intended to give a broad range of clinical experience. But it is important to realize, if you come here, there will be substantial parts of the course that will be delivered outside of London. We also aspire to be global facing. Like most medical schools, we offer an elective in the final year. That's a 10-week period where you can choose to pursue a topic of your own interest and, in most cases, in a location of your own choice. To facilitate that, we have twinning links with 12 medical schools around the world where their students come here for clinical attachments and our students go there. So Australia, India, Japan, a wide range of countries. Plus you can make your own arrangements at other facilities in other countries. Now I mentioned that we have a number of different routes into the program. Most students will come through the A100, which is our 6-year program. And I say 6, 5 years of that program are the core medical training. 1 year is an intercalated Bachelor's of Science degree, which offers the opportunity to pursue an area of interest, which may be directly related to medicine, but may be more tangential. It could, for example, be medical humanities, ethics and law. It could be biomedical research. And in the past, this has been what we call an opt-in, so some people have chosen to do it. Going forwards, this will be an opt-out, so we will be the expectation that people coming into that 6-year course would do a BSc, because we believe that's an important part of the educational experience we offer here, and is an important qualification for subsequent entries into the workforce. But there are certain provisions if someone has a good reason for not doing it. For example, if they've done a degree previously, or there's certain social circumstances, then it can be done in 5 years. The A101 Extended Medical Degree Program is a really important part of our provision and one which we're expanding this year because it's been so successful. And that is aiming to offer a route into medicine for people who have less opportunity to gain the academic qualifications because of their educational or social circumstances. The offer in terms of grades is somewhat lower than for the A100 course, and the material that normally covered in the first year of the A100 course is covered over 2 years in the A101 course. After those 2 years, with intensive mentorship and support, students then enter the second year of the A100 course in exactly the same way as everyone else. Now, the prerequisites for this course are really very specific in terms of postcodes and school type attended. So if you think you might be interested in that program, it's important to check the website and see whether you might be eligible or not. We also have a small number of places for graduates in biomedical sciences who can do an accelerated program in 4 years. Interestingly, many of the students on our A100 course are in fact graduates, and they chose to do the 5-year program rather than the 4-year program. The graduate entry program, as it currently stands, has an intensive 3-month block in the summer, and then they go straight into stage 2 of the conventional course. So it's very closely aligned. To be eligible for that course, you have to have quite a strong science background already because it's very accelerated. There's a very small number of places for people who previously qualified in dentistry and want to go into maxillofacial surgery. So this is how the course looks. It's 3 stages. The first stage is the foundations of medical and public health science with some early clinical experiences, largely learning clinical skills and communication skills, not going into clinical settings. But in stage 2, you're rapidly accelerated into early clinical experience. There is in that year a longitudinal placement in general practice. So students go 1 day a week throughout the year to the same general practice, a fantastic opportunity to work with a single tutor and to see real clinical practice. And there's also a day a week in hospital practice. So that second year, still biomedical science back here, but 2 full days a week are clinical practice. The third year, balance shifts again, 3 days in clinical practice, including a day a week in a mental health setting, and the rest of the week in science-based teaching. We then have the intercalated BSc year, and then stage 3 is really focused on the practical experience that will prepare you for starting work as a doctor. So that involves clinical rotations in the major specialties of medicine, together with electives, and a substantial period in the final year after final exams have been taken, where there's an opportunity to shadow a junior doctor and learn the nuts and bolts of doing the job prior to starting as a foundation doctor on graduation. Perhaps I'll just quickly run through the detail of the 3 stages and then take some questions. So as I say, the first year is science-based teaching, also includes a strong public health and behavioral focus, an introduction to what we call values-based clinical practice, encompassing clinical skills, communication skills, ethical reasoning. Stage 2 is integrated clinical and preclinical. And as you can see, the blocks are not described in terms of conventional clinical specialties. We have blocks such as aging and supporting life and human development. And one of the things we've tried to do in our new curriculum is get away from the idea of teaching medicine through the lens of a specific specialty and to try and think about the journey of the patient. Now, of course, in practice and clinical settings, you'll still be working within clinical specialties. But I think that's been quite a useful change of focus to thinking about what are the overall areas that we need to train our doctors in, rather than which specialties do we have to rotate them through. Same is true in stage 3. In year 4, the penultimate year, there's a block in child health, pediatrics, women's health, obstetrics, gynecology, breast surgery, emergency medicine and critical care, and a block in mental health. And of course, one of the great strengths of this medical school is that we have the Institute of Psychiatry, Psychology and Neurology, the Maudsley Hospital, probably the leading centre for mental health care and research in Europe, if not in the world. And then in the final year, 3 blocks: general practice, acute care encompassing medicine, surgery and other front door activities, and a block that we call long-term conditions, which is trying to focus on clinics and ward-based teaching around chronic disease, gerontology and related disciplines. Final exams are taken in January. That offers the opportunity for a resit in May. That's been a new feature which has come in this year for the first time, and it's meant that for the first time ever this year, no student has had to retake a year having failed exams in the summer. So our objective is to get every single graduate graduated on time. The final 6 months of the course are very much focused on personal choice, a career development period where you can choose a clinical area to work in the UK, the elective, which can be taken overseas or in the UK, and then the transition to F1, which is the preparation for practice. So that's really the structure of the course. This is not what is described as a pure problem-based learning curriculum. We have more of a hybrid. There certainly are lectures, but we do have what some people might describe as a very strong case-based learning focus. So it's similar to problem-based learning in terms of dealing with problems. The difference really being that in problem-based learning, it's all down to the students to generate the issues, to go away and do the research and come back. With case-based learning, it's more solving problems in real time under the guidance of a faculty. So this is a particular interest of mine, and as I indicated earlier, our students in the later years of the course are quite widespread across the southeast of England. What we've instituted in the last year is a program of interactive web-based teaching, so everyone can dial in from wherever they are and talk with an instructor and have a tutorial via the web from wherever they may be based. And those are largely based on solving clinical problems, so what you call case-based learning.
Obviously, we've heard lots about the actual programme, and now I'm going to be talking about the application process. So, what are we looking for? Well, I think it goes without saying that we want a strong academic record as a science student. So we want to see how well you've done with the scientific content of your courses, whether that's A-level, IB, or if you're doing another relevant qualification. Yes, so we do want that academic interest and that record. So yes, we're going to be looking at your predicted grades, but also we might take into account your GCSEs as well. We don't put so much of a strong emphasis on them until later on in the process, but we do use those as a differentiation measure. But I think what we're really looking for, and I think it's most important, especially for the course at King's, is, well, we're looking for a genuine enthusiasm for medicine. But when we're talking about enthusiasm, I feel a lot of students sometimes find it difficult to say, well, what does that look like? What does that look like in real life? And I think what it really means, essentially, what we're going to be looking for, yes, an enthusiasm. What we're looking for is a bit of geekiness about medicine and about medical science. We're all a little bit geeky about something, whether we're willing to admit it or not. And what it is the thing that you talk to people about, the thing you want to shout about from the rooftops. You talk to your parents and they start to glaze over. It's something my mum does a lot with me. So that's what we're going to really be wanting to see, and that's what makes you stand out. It's going to be that real love for medical science, that real passion and that drive to work with patients. And that is really what's going to make you stand out. And I'll talk in a little bit more detail about that later, about some of the ways you can evidence that. We're looking for practical experience of healthcare. Now, we're not expecting everyone to have completed work experience in a hospital, a period of 2-3 weeks or whatever. We know how difficult that is for students, for you to get, especially if you're under 18 in some areas. So yes, if you can get shadowing, if you've spoken to healthcare professionals, really here what we're looking for is an appreciation of what's going to be involved, both on the course and once you're working as a medical professional. As I'm sure you can all appreciate, and as we've seen in terms of the timetable of what you're going to be doing over the next few years, it's going to be very intense, both emotionally and physically. So we need to know that you know what you're getting yourself in for. And we're also looking at experience of other things, so values, behaviours that can be expected in the medical profession. So all the interprofessional kinds of experiences. So what we're talking about here is are you good team working? Are you good at collaborating? Are you a excellent communicator, both verbal and non-verbal? And are you good at customer service, patient care? And those are going to be, all these sorts of values and behaviours, independence, all those sorts of things are going to be absolutely essential when you're working in the medical profession. And that's exactly what we're going to want to see in your application. So, these are the kinds of qualities that we're going to be looking for in medics at King's. So if you can demonstrate some of these within your personal statement, and then later on, if you're successful to be invited into interview, then you're halfway there. So I've already touched upon it, but making sure you're informed about the career, what you're going to get to be into. Motivated to help people, that is absolutely essential, and I think we've already covered today how central the patient is. So it's not just there for the status, I'm a doctor. We want to see that you want to help people. Community orientated falls into that as well. So you want to get out into your local community and make a difference. Creative and flexible thinking, because that's going to be essential when working as a medical practitioner. A leader, a good judge, what's the problem solving? What is your fit like in terms of practice? Should you be working with people really, or is an actual research approach probably going to be better? That's going to be really obvious from your personal statement, going back to that motivation to help people, those interpersonal skills which are absolutely essential. And we're looking for people who are going to be resilient, but most of all, who are going to be honest, who have integrity. And all of these things we'll want to start to see the seeds of in your personal statement and when it comes to interview. In terms of entry requirements, hopefully you should already be aware of this, but I will cover them briefly now. So we are looking for A-star AA at A-level, and that includes chemistry and biology. We don't actually require a 4th AS, so if some of you had inquired into our medical programme just a couple of years ago, that was an additional requirement. But with the changes of A-level qualifications, we've now dropped that requirement, but as a result, our grades have lifted to A-star AA. And in terms of GCSEs, they are also absolutely essential. So if you completed your GCSEs in the new system, we're looking for a grade 6. With the old system, it's a grade B. And if you're currently studying the International Baccalaureate, the IB, very, very similar. So we're looking for 766 at your higher level subjects. So in the same way that we're looking for chemistry and biology in A levels, we're going to be looking for chemistry and biology in 2 of your 3 higher level subjects. We're looking for the overall point score of 35 within there. Again, GCSE, English and Maths, but if you have done the standard level diploma, then we're happy at the standard levels if you've done those as part of your wider IB diploma. If you have got any other qualifications, then you can go online to find out more. If you're looking to study the EMDP, slightly lower, we're looking at ABB at A level, but again, you must have biology and chemistry. And again, for the IB, 655, but we're keeping the point score the same at 35. And GCSEs will remain the same as well. But as you've heard earlier, there really are strict eligibility criteria. So you need to be a home or a EU student within non-selective education. So that would be a non-selective state school since the age of 11. Should have not previously studied a degree. And in terms of the postcode measures, we look at certain eligibility in terms of where you live and where you're from, and we use the ACORN measure for that. And so you can easily go and check this online. Or if you are currently part of one of our widening participation activities, so MedView, K+, or Realising Opportunities, this is a separate criteria for the ACORN data, because we know that, especially in London, that's not always a reliable measure. UKCAT is something that we ask for here, so hopefully you should already be aware of this. Some of you may have already started taking it. So we're not looking for a particular threshold here because it does vary year on year, but on average we're looking for around 650 plus. We take a very holistic approach to our admissions process, so we look at everything in conjunction with each other. But if you're looking for a guideline, that's the kind of figure we're looking at. And we do sometimes take the situational judgment test into account, especially for those sort of more borderline cases. With the EMDP, so the Extended Medical Programme, there is a slightly less emphasis on the UKCAT. Now, with the personal statement, I said earlier we wanted to see a little bit of geekiness about wanting to study medicine, and that's really where you should be showing it. So we've already talked about relevant work experience, so whether that's shadowing doctors, but to be perfectly honest, volunteer work or paid work within any sort of healthcare or caring setting is going to be sufficient to evidence that. We are looking for other extracurricular activities, especially in relation to the community connection, looking for involvement within the community, but it's not listing everything. It's about keeping it relevant, keeping it to the point, and demonstrating exactly how the skills that you've learned from that activity, whether it's leadership skills, teamwork, communication, will relate directly back to the course. And it's not, again, just about saying what you've done, it's about the reflection as well, looking at what you've learned, the journey that you've taken. We'll be interviewing to really assess your key skills, and those are, again, the suitability for the health profession, communication skills, scientific knowledge, that ethical approach, and decision-making skills. And we do these in the form of multiple mini interviews at King's. Now, we've changed up our process a bit just for medicine, so if you're applying for any of the other clinical courses, it might be different. But for medicine, you'll have 7 stations, an interviewer in each one, and 7 minutes to answer each question. And it'll be on a variety of topics. There'll normally be one question, but there may also be a follow-up, so it may be a 2-part question there. It's not a case of just shoving you in the room and letting you go. There will be briefings before and after. It's really about being prepared and knowing what to expect. MMIs are very different to a traditional panel interview. So if you can practice answering questions within a 7-minute period, in a noisy area, maybe in the school or college canteen, get friends to ask you questions within a set time limit, then that's a really good way of practicing being in that environment. Practicing questions, but also being aware of what is happening within the wider news, current affairs. BBC News is pretty good at keeping you up to date on the basics of things that are likely to be of interest to your patients and therefore to us. So, in terms of the timings for the application, the 15th of October is your UKCAT deadline, and that's the hard UKCAT deadline. I say UKCAT deadline because for those of you who are currently in school or college, your schools and colleges will have an internal deadline that you have to adhere to make sure that they have enough time to complete your reference, check your application and so forth. The 2nd of October is the last opportunity to do the UKCAT. And after we've received applications, you can expect to hear from us about whether you have an interview, and they will take place between December and March. All of these decisions are made through our online programme called King's Apply, our online portal, so you can keep an eye on your account for all those updates there. Thank you very much for listening, and enjoy the rest of your day.